In the previous section, we talked about the improvement roadmap. What happens after you supplement vitamin D? Today, I will continue to share about creating a vitamin D supplementation plan. Part 5. Consultation with your doctor and creating a vitamin D supplementation plan. You've started to feel different. Your legs are stronger. Your vision is clearer. Your mind is no longer clouded like before. But to go further, you need a professional companion. Your doctor. This is the time to confirm what you're feeling. Not to ask for permission, but to work together with your doctor to create a scientific, accurate, and long-term plan. Why consult with your doctor? Determine the correct dosage. Each person absorbs vitamin D differently. Check for potential drug interactions if you're taking medications for heart disease, hypertension, or diabetes. Monitor effectiveness through regular testing. Boost motivation by having a professional companion on your journey. You don't have to talk to your doctor to take D3. But if you want this journey to be truly solid, take the initiative to do so. How to start the conversation. Many seniors feel shy when seeing a doctor because they're unsure about how to ask the right questions. Here's a simple and clear way to start the conversation. I've been reading that vitamin D can affect muscle strength and balance. I'd like to check if I'm deficient so I can supplement properly. I hope you can help me with the test and advise on an appropriate plan. Tests you should request. Test name 25-hydroxy vitamin D, 25-OHD. This is the international standard test to measure the level of vitamin D circulating in the blood. The most accurate method to determine whether you are deficient or sufficient. The results are usually reported in the unit, Ing/ml. What if you haven't had the test? Although it's best to get tested. If you're unable to due to cost or convenience, you can still start with a safe low dose, 1,000 IU/day, and monitor any symptom improvements over 4 to 8 weeks. However, to manage it well, you should keep a weekly log of your body's response. Avoid taking multiple supplements with D3 at the same time. Schedule a test within the first 2 to 3 months if possible. What should you ask your doctor? How many IU/days should I supplement? Do I need to check my magnesium or calcium levels as well? I am taking medication ABC. Could affect this? When should I have the test again? If my vitamin D level is too low, can the doctor prescribe a temporary higher dose? The most important thing, your doctor is a companion, not an authority. You don't need to fear that your doctor will oppose your initiative. On the contrary, many doctors appreciate patients who are proactive in understanding their bodies, ask the right questions, and collaborate in creating a plan. You don't have to go through this alone, and you are not passive, waiting for someone else to make decisions for you. You are the one making the choice. Your doctor is there to support you. Choose the right type of vitamin D3. Don't waste your effort. There are many types of vitamin D on the market today. However, not all of them are well absorbed, especially in older adults. You should choose vitamin D3, cholecalciferol, because it is better absorbed than vitamin D2, ergocalciferol. It helps maintain stable levels in the blood. It is safe for long-term use. Many studies have confirmed its effectiveness in restoring muscle and bone health. Common safe dosage, 1,000 to 2,000 IU/day. Which form is the easiest to absorb? Soft gel capsules, easy to swallow, fast absorption. Liquid drops, ideal if you often forget to take your medication. Spray absorbs through the mucous membranes in the mouth, equivalent in effectiveness. However, regardless of form you choose, it's best to take it with a meal that contains healthy fats for optimal absorption. The crucial role of magnesium. Many people supplement D3 adequately, but still don't see significant results. The reason may be a magnesium deficiency, the element that enables D3 to work effectively. Magnesium helps activate the enzyme that converts D3 into its active form, increase calcium absorption at the right places, reduce the risk of cramps and spasms, support nerve function, muscles, and sleep. You can supplement magnesium through food, dark leafy greens, pumpkin seeds, cashews, black beans, oats, or through supplements. 250 for 100 mg/day. Choosing magnesium glycinate if you're prone to diarrhea. Proper sun exposure. Not much, just consistent. There is nothing more valuable than sunlight. Each morning, just 15 to 20 minutes of sun exposure before 9 a.m. can help your skin synthesize 600 to 1,000 IU of vitamin D. Important notes. No need to remove your clothes. Just expose your face, neck, and arms. Do not use sunscreen during this time. Stand in direct sunlight, not through glass. If your skin is darker or if you live in an area with limited sunlight, rely more on vitamin D3 supplements. What to eat to support vitamin D supplementation effectively. Foods may not be as rich in vitamin D as sunlight or supplements, but they still play a supporting role in enhancing absorption and maintaining muscle and bone health. Fatty fish, salmon, mackerel contain vitamin D and omega-3. Eggs. Egg yolks contain natural vitamin D. Sun-exposed mushrooms. Fortified plant-based milk. Fortified margarine. A great breakfast combination. Eggs plus walnuts plus orange juice. A delicious recipe that's also great for your bones and nerves. Weekly monitoring schedule. Keep a steady rhythm. Avoid forgetting and quitting. Here's a simple table you can print and stick on your refrigerator or health journal. Be careful with high doses. Don't let more become harmful. Some people think the more the better, but with vitamin D, excessively high doses can be harmful. D3 is fat soluble, and if it accumulates too much, it can cause hypercalcemia, fatigue, nausea, irregular heartbeat, lead to kidney stones and digestive disturbances, disrupt magnesium balance, causing cramps in return. Only take high doses, above 4,000 IU/day, when prescribed and monitored by your doctor. When to have the test again. If you've been supplementing consistently for 1 to 2 months, ask your doctor to retest after. 3 months if you're taking a high dose, as prescribed. 6 months if you're on a maintenance dose of 1,000 to 2,000 IU/day. Retest if you're still feeling tired, shaky, or haven't noticed significant improvement. At this point, the doctor will use the results to lower the dose if it's too high, maintain the current dose if optimal, adjust your diet, sun exposure, and physical activity accordingly. Common mistakes to avoid when supplementing vitamin D. Taking it on an empty stomach without fat reduces absorption. Taking it with high doses of calcium increases the risk of kidney stones. Not supplementing magnesium. D3 won't work at its best. Not monitoring symptoms. Unsure if improvement is happening. Stopping because of forgetting a few times. The body doesn't accumulate enough. Remember, D3 is not a magic pill, but it is the foundation. It doesn't replace sleep. It doesn't replace a healthy meal. But when used correctly, it's the sunshine you can hold in your hands every day. Message for you. You don't need to become a medical expert. You just need to know, what do I need? I will ask the right questions. And I will move forward stronger than yesterday. Doctors are not the ones giving orders. They are companions, but you are the one holding the wheel. Part 6. Final message and inspirational conclusion. Subtitle: This is not just a story about a vitamin. It's a story about you. Take a moment and reflect. You have been on a journey, not with your feet, but through the choices of your mind. You've learned that muscle weakness is not a fate of aging. You've discovered that vitamin D is not just sunlight, but the foundation of strength. You realize that by simply listening to your body and taking small, steady steps, you can change yourself. Together, we have gone through Part 1. Strong steps can be revived if you start today. Part 2. Muscles don't work without vitamin D. The forgotten switch that controls them. Part 3. The first signs subtle, but very clear if you pay attention. Part 4. A true recovery journey. Each week, each small change, accumulating into strength. Part 5. Actively talking to your doctor, choosing the right vitamin, and building long-term habits. You are no longer the person waiting for good things to happen. You are the one creating good things for yourself. This is not just a health journey. It is a journey to reclaim freedom. Freedom from the fear of falling. Freedom from a feeling of helplessness. Freedom to go outside without needing assistance. Freedom to carry your grandchildren, tend the garden, dance, travel, and live, not to prove anything to anyone, but to prove to yourself that I can still do it. If you've made it this far, you don't need to understand all the research. You don't need to know every IU unit. You just need to have started changing. Have I taken my vitamin D today? Can I stand up without straining? Do I still shake when stepping down the curb? Am I laughing more lately? That is true recovery progress. And finally, if this video has helped you, hit like to spread the value to others. Share it with your loved ones because they also deserve to be healthy. And leave a comment. Share your story or simply how you started. Because a healthy community doesn't begin in a hospital. It begins with each person knowing how to care for themselves and moving forward together. A message from the team, from us, the creators of this video, to you, the one watching every last second. We wish you steadier steps, brighter days, and a life as fulfilling as you desire. Thank you for joining us on this journey. And always remember, keep moving forward, keep growing, keep shining, because you deserve it.